Mr. Kirk?
Yes.
Hi, my name's Chris. I'm going to be your student nurse today. Let me just wash my hands and put my gloves on real quick. How are you doing today?
Good, how are you?
Good, thanks. Can you confirm your first and last name for me?
Joseph Kirk,
And your date of birth?
9/11/1995.
Good. All right, that confirms with your chart. Can I just look at your medical bracelet? All right, that confirms as well. Good. Any allergies to medication, food, latex, environment? No? All right, and I confirm that. Very good. All right, Mr. Kirk, I'm just going to get some vital signs from you. Let me check your temperature. 98.6, that's within normal range. Very good. I'm going to put this pulse ox monitor on you just to check for your oxygen saturation and your pulse. Good, 98% oxygen saturation and a pulse of 65. Very good. All right, and then I'm just going to count your pulse as well. I'm going to count your brachial pulse right here. And what I'm actually really doing, for the patient is I told him I'm counting his pulse just so you don't get nervous while I really count your respirations, counting them for 30 seconds. And then I'm going to multiply by 2, 15 breaths per minute. So that's very good. That's within the normal range. So good. All right, so that's all your vital signs. And can you tell me what day it is today?
Thursday.
Okay, so conscious is there, person, you're cognizant of person, place. You told me your name, you told me your date of birth, what day of the week it is. So that's good. And I'm just looking at your symmetry. Good, everything is symmetrical bilaterally. Arm length is symmetrical, leg length symmetrical. Very good. So that's good. Any pain today?
Yeah, in my left knee.
In your left knee? In your left knee you said pain?
Yeah.
Okay, and when did it start?
I think a couple weeks ago.
A couple weeks ago? And how long when the pain occurs? How long does it
Usually
usually
just
last?
when I'm exercising.
When
so
you're
like,
exercising?
Yeah.
Okay. What's the feeling of the pain?
It's like sharp. Almost.
Sharp pain?
Yeah.
Okay, sharp pain. You said it's when you're exercising it gets worse.
Mm-hmm.
Okay. Done anything you do that makes it feel better?
Icing it usually.
Icing it helps?
Yeah.
Okay. And besides icing, have you done any other treatments for it?
Some like warm compresses too.
Warm
That's
compresses?
yeah.
Any like Tylenol, ibuprofen,
No.
any pain meds?
Mm-hmm.
Okay. And just when you exercise, it
Yeah.
gets worse? Okay. And if you had to rate your pain on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever felt, what would you rate it at?
It's probably like a 6.
A 6?
Yeah.
Okay, when you're exercising. When you're exercising, it's a 6?
Yeah.
Okay, when you're not exercising,
Usually you don't feel much, right?
you don't really,
Yeah.
so then you put it as a 0?
Yeah.
Okay, but the exercising is what's causing it to be a 6? Okay, thank you. All right, so next, after I went through old carts for the pain, documented that. Obviously, the patient doesn't have any equipment, but if he did have equipment on, oxygen mask, I would check if it's a face mask or under the nose, make sure there's no skin breakdown, make sure there's no excessive dryness, make sure there's no kinks in the tubing, and confirm that the flow rate matches the prescription on the patient's chart. Obviously, you don't have an IV as well, but if there was an IV, I would make sure that the IV prescription bag matches the prescription on the chart. Once I confirm that, I'll also, make sure there's no kinks in the tubing. It's flowing properly at the IV site. I want to make sure there's no erythema or redness, no edema or swelling, and, making sure there's no risk of infection, and making sure, palpate the skin, make sure there's no excessive, warmth or heat. So that would be that. And finally, if you had a urinary catheter, I would make sure, again, that there's no kinks or loops in the tubing, that the drainage bag is hung properly, and that the urine, make a note of the color to make sure it's hopefully like a pale light yellow to show good hydration. Make sure it's not full, and make sure the tubing is properly attached to the leg, as well as the site of the catheter. Again, no swelling, no edema, no skin breakage. So after looking at the equipment, next I'm going to look at your skin, hair, and nails. So, Mr. Kirk, I'm just going to check your hair. Have you noticed any excessive, dryness or any hair loss out of the ordinary lately? No. Okay, nothing suddenly, no changes?
No.
Okay, and I'm just going to check your hair. Yep, and no flakiness, no dryness, so that's good. I don't see any dandruff. Hair is a good color. There's no, bald patches. It's full and symmetrical throughout, so that's good. Next, I'm going to check your skin, okay? I'm just going to make sure that, the temperature is the same bilaterally. There's no, warmth in any spots. Good. And temperature is the same on both sides, so that's good. Next, I'm just going to check your skin for both like hydration and edema. So I'm just going to pull your skin up, and that kind of shows we know there's no edema or swelling if I'm able to do that. And then as I release, I'm checking skin turgor just to make sure, good hydration. And I'm doing that on, both sides for symmetrical, and I'm going to do it on your leg as well. Very good. And so next I'm going to check your nails, just make sure there's no, bluish coloring, which would be cyanosis. That would show, low oxygen levels. That's good. No concave, so that's good as well. Very good. Okay. And toenails look good as well. Skin looks good of equal color bilaterally. Spots where sun would be exposed, the skin is a little darker, but overall it's the skin color that matches the patient's ethnicity. So that's very good. It's what we'd expect. No wounds or cuts at all?
No.
Okay, good. If there was, I would check the wound for the stage of healing it's at. Make sure it's not warm to the touch, that there's no edema or swelling, erythema, any signs of possible infection. So that's good. And then, so finally for your nails, I'm just going to check your capillary beds. So I'm just blanching your nails, and so they turn a pale white, and then they come back to color red. And I'm just making sure, that it does it in under 3 seconds, and that shows good capillary bed responses. Good. Your toes are a little cold. Are your feet always cold?
Yeah, they're usually cold.
Okay.
There's like air conditioning.
I know that, the air conditioning is running in here because it's hot today, so I totally understand that. Your big toes look a little white. Are they usually that color?
Yeah.
Okay. That's not out of the ordinary? You've had that for a long time? Okay.
Yeah.
All right. So after your skin, if you could just sit up for me, Mr. Kirk. Thank you. I'm just going to check your ears with my flashlight, okay? You could just turn to the side. I'm just going to lift up on the peanut and just make sure. Yep, it's a pearly color, no red, no swelling, no drainage, no excessive earwax.
No.
Okay, and if you do, I'm just going to check the other side as well. And everything looks good there as well. Both ears are same shape and size, good symmetry bilaterally, so that's good. Okay, so next I'm going to check your nasal. If you could just lift your head back for me. Good. No wounds, no lesions, no drainage, no runny nose, bloody nose, anything like that, excessive or out of the ordinary or all of a sudden?
No.
All right, good. Everything looks good there. Face looks good and symmetrical. Eyebrows are good. So that's good symmetry there, which is always important. So next I'm going to check your eyes. Could you just put your hand over your bridge, your nasal bridge like that? Perfect. So I'm going to just come from each side with the light, and you just look into the light as I come, okay? I'll come slowly. Good. And I'm going to do it one more time on this side. Good. And that shows accommodation, that both pupils are reacting at the same time. They're constricting as the light comes. Very good. Okay, you can put your hands down for me, Mr. Kirk. Thank you. So next, can you follow my finger? So I'm just going to move it in. Just follow my finger as I move in. Good. And I'm just going to do it one more time. Good. And that's for testing convergence. Your eyes, they would get cross-eyed as I get closer, which is good. And your pupils constrict, which is good. Good. So I'm just going to now just look at your pupils, okay? Let me just say, you can just look right into the light. Good. Both pupils are equal in size. They're round. They're reactive to light and accommodation. So that's very good. Those are all normal findings. All right. And then last but not least, I'm going to check your tongue and mouth. So if you could stick your tongue out for me. All right. Color looks good. It's a pink palette. It's smooth. No, sores or lesions, which is good. No bumps. Now, could you say ah for me? Perfect. Tonsils are within midline. Okay, no redness, no swelling. So that's good. No difficulty swallowing. No. Okay, good. And then finally, if you could just smile for me, Mr. Kirk. Yep, show me your teeth. Good, teeth look good. No gums are receding, and the smile is symmetrical on both sides. So it's very good. All right, thank you.
Oh, thank you.